Dear students, welcome back. In the previous session, we have discussed about the unilateral stance and the compressive forces which are acting at the hip joint. So, when you compare with the bilateral stance and the unilateral stance, the supporting hip joint is receiving more compressive forces in the case of unilateral stance. Okay, so there are several options available when there is a need to decrease hip joint compression. Some compression reduction strategies occurs automatically, but a cost of extra energy expenditure and other structural stress in our body. And also other strategies require interventions such as using assistive devices to minimize the energy cost. Okay, so these are some of the other strategies which can we reduce the energy expenditure. Okay, and also the hip joint compression. Okay, now so this compensatory lateral lean of the trunk is one of the compression reduction strategy which occurs automatically. Okay, now the gravitational torque at the pelvis. So we have calculated already in unilateral stance if the person weight is about 180 lb. We have taken the same thing, same weight here also. The gravitational torque at the pelvis is the product of the body weight and the distance that of the LOG. Okay, which lies from the hip joint. If there is a need to reduce the torque of gravity and body weight cannot be reduced, then the momentum of the gravitational force must be reduced or minimized. Okay, and this can be accomplished by laterally leaning the trunk above the pelvis towards the side of the pain or weakness. So as we know that in the previous session, if you reduce the weight, there may be a chance of reduction of compressive forces at the hip joint. But if the joint is paining, at that time we can't reduce weight, isn't it? So for that, so any other compensatory mechanism, like so if you have seen anybody who is having a pain in the hip joint, some persons will move on the, that means they will lean on the same side of the pain at the hip. So if you observe it, okay, so that is one of the position we can minimize the compressive forces. So how it occurs means, once we lean on the same side of the pain, then what happens, the LOG is going to shift on that same side. If it is right side, so the person is leaning on the right side, the LOG is going to shift towards the right side. So then what is the distance? The momentum of the LOG is going to reduce here. So for example, the LOG of the momentum, the gravitational adductor force we can see. So the distance between the joint axis and this one is 1 inch. Then what will be the torque, the gravitational adductor torque produced at that joint is? So as we know that this compressive forces, so the which is acting, okay, which is acting on the hip joint, we know that that is HATLL. So that means weight of the upper body, okay, that is superimposed, and the left leg, we can left limb we can take, that is 1/6 of the weight. So totally it becomes 5/6 of 180. That is we will get how much? 150 inch lb we have calculated already in the previous session. So then the compressive forces is 150 inch lb. Okay, then what is the torque produced by the gravitation is torque is equal to, so this is the compressive force into perpendicular distance, isn't it? So then what is the force? 150. So how much is distance? 1 inch. So then it becomes 150 inch lb is the torque. 150 inch lb is the torque which is produced by the gravitation, that is called as gravitational adductor torque. So if only 150 inch lb of adduction torque were produced by the superimposed weight, what is the abductor force needed then? So this is the torque produced by gravitation. What is the counter torque produced by the abductors now? So the distance, the momentum is don't have any change here, isn't it? So but we know the gravitational adductor torque, that is how much? 75 lb, and we want to calculate the force of this one abductors. Okay, and into we know the distance, that is 2 inches. Okay, I have taken 2 inches instead of 5 centimeters. So then the abductor force is equal to 150. I have given the answer, sorry. So 150. So 150 by 2 you'll get 75 lb. So the abductor force which is created by, this is the counter torque created by the abductors is 75 lb. Okay, so that means it becomes half of the gravitational force, adductor force. So that means 150 by 2 we will get 75 lb. So that is the adductor force, abductor force. Now, so we have seen this abductor force now. So then what is the total joint reaction force now? Total hip joint compression force or joint reaction force, both are same. So as we know that 150 is the compressive force and 75 is the abductor force, and totally 225 lb is the total hip joint compression. Okay, so if you see in the unilateral stance in the previous session, we got 450 lb of total hip joint compression, isn't it? Now leaning to one side, it reduces to 225 lb of total hip joint compression from 450 lb of total joint compression in the which we have seen in the unilateral stance. Okay, so this reduction is enough to relieve some of the pain symptoms which are experienced by someone with arthritic changes in the joint. The compensatory lean is instinctive and commonly seen in people with hip joint disability. When a lateral trunk lean is seen during the gait, and it is due to hip abductor weakness. So, when a lateral trunk lean is seen during gait and it is due to hip abductor muscle weakness, then such gait is known as gluteus medius gait. If the same compensation is due to hip joint pain, then it is known as antalgic gait. That is painful. Due to pain, the gait is modified. That kind of gait is called antalgic gait. If hip abductors are going to weak, then you can see some dropping of the pelvis during gait. Such gait is called as gluteus medius gait. Okay. Now, in some instances, the 75 lb abductor force we calculated as necessary to stabilize the pelvis using a gluteus medius gait is still beyond the work capacity of very weak or completely paralyzed hip abductors. So in such cases of extreme abductor muscle weakness, the pelvis will drop to the unsupported side even in the presence of lateral lean trunk also. Okay, to the supported side. So, if lateral lean and pelvic drop occurs during walking, the gait deviation is commonly referred to as Trendelenburg gait. So, what happens if you see we are reducing some pain by leaning trunk to the affected side, isn't it? Due to any muscular weakness or pain, anything. Yes? But during walking still uses more energy than ordinarily required for single limb support. For such kind of gait, it requires more energy, and also it may result in stress changes within the lumbar spine also. Why? Because the LOG is shifted towards the right side and it is causing a lateral flexion also, isn't it? Lateral flexion in the lumbar spine. So, which causes stress in the lumbar spine if we used such kind of gait over an extended time period. So, using a cane or some other assistive devices offers a very good alternative to the person with hip pain or weakness. Okay, so this is the other alternative to reduce this hip compressive forces, and also we can reduce the energy, isn't it? So very important. The energy of the body is also can be reduced by using the cane. Okay, some assistive device is called cane. So here the another important thing you have to consider is on which side the cane should be used. Whether it is used on the affected side, for example this is right side, the cane should be used on the affected side, or the other side, that is use of cane ipsilaterally, the use of cane contralaterally. So which side is better to use the cane to prevent lateral lean trunk also? Okay, so pushing downward, so first we will see how much energy or how much total hip joint compression can be seen if use of cane on the same side. So if we use same side, so what are the effects? So we are using the cane on the same side. So pushing downward on a cane held in the hand on the same side of pain or weakness would reduce the superimposed body weight by the amount of downward thrust, that is some of the weight of HAT would follow the arm. So some of the weight would follow the arm and then to the cane. So the amount of weight which is following the arm will not pass on to the hip joint. Okay, so that means some of the weight is reduced by using this cane. Okay, yes. Assuming that again the person is having 180 lb, he is the person is pushing down the cane with approximately 15% of his body weight. He will reduce his 150 lb of gravitational force. So already we know that 150 lb of gravitational force, that is HAT and LL, acting on the pelvis, okay, by about 25 lb. So already how much the force is reduced by this pushing of this force is 25 lb. Okay, how it happens means, so in this case again we can calculate the weight compressive forces. So we'll get again 150 lb, that is gravitational adductor forces. Okay, and this 150 lb, for this 150 lb the abductor force created is 75, isn't it? So that 75, 25, that means 1/3 of this abductor force is transmitted to the pelvis to maintain the torque of the pelvis. So that amount of 25 lb is reduced now here by pushing with the thrust. Okay, yes. Now, so with the gravitational force diminished to 125 lb, okay, the torque of gravity, so here there is no, if the person is using cane, there is no chance of leaning of trunk. So to avoid this leaning of trunk, we are using this cane. Then what is the distance between this momentum with the LOG? Normally this LOG will forms in the same position, that is near S2. Okay, so then again we will see in the first bilateral stance, then there the distance of or unilateral stance, we have found that it is 4 inches. So that 4 inches is to be calculated with this reduced compressive forces, that is 125 into 4, then it becomes 500 inch lb. Okay, so for this 500 lb, so what is happening here? This 500 lb, now we know the 500 lb, which is creating gravitational adductor torque. Then how much abductor force is required now? How much abductor force is required, isn't it? So then it is the momentum of gravity with the torque of the gravity at 500 inch lb. So the required abductor force, here there is no change in the distance, that is 2 inches is maintained here. Okay, so then the abductor force for this one, for the torque which is created here, we will get 250 lb. So the new joint, hip joint reaction force using a cane ipsilaterally, we will get how much? Total 125 we got, and the abductor force is 250, and the total one is 375. So what is happening here? The hip joint reaction force using a cane ipsilaterally is increased than in the compensatory lean trunk. In the compensatory lateral lean trunk, we got to only 225 total hip. Now here 375. So using cane on the same side, may reduce the energy cost but not the hip joint compression. Okay, compressive forces. So that is the thing. So to get better results, so using the cane in the contralaterally will give better effects. It will reduce both hip joint compression, okay, hip joint compression, as well as the energy cost. Okay, so if you see in the contralaterally, if you see the use of cane contralaterally, then you can find the variation there. So that thing we can see in the next session. Thank you.